Hi, I'm Daniel, and welcome to the first official episode of Pressure Check. Each week, we look at the latest glaucoma news, research, treatments, and technology, then break it down in plain English for patients and caregivers. This week, we have 5 stories worth watching. A new way of thinking about glaucoma diagnosis called oculomics, research on 24-hour blood pressure monitoring and glaucoma progression. A ZOLYMBUS partnership focused on virtual reality visual field testing, a large study looking at sleep apnea and glaucoma risk. And the US launch of ZOLYMBUS, a preservative-free bimatoprost gel for lowering eye pressure. Before we start, Pressure Check is for education only. I'm not a doctor and this is not medical advice. Never change your treatment without talking to your ophthalmologist or eye care professional. Let's get into it. First up, oculomics. That sounds technical, but the idea is pretty simple. Oculomics is the use of detailed eye data, especially from imaging, combined with artificial intelligence and large data sets to better understand disease. For glaucoma, that could mean looking beyond just eye pressure and standard test results. Doctors already use tools like OCT scans, visual fields, optic nerve imaging, and pressure measurements. Oculomics asks, what else can we learn from all that data? Could patterns in the retina, optic nerve, blood vessels, genetics, or other biomarkers help identify glaucoma earlier? Could they help predict who is more likely to progress? Could they eventually point toward more personalized treatment plans? That's the exciting part. The patient takeaway is this: oculomics is not a new treatment you can ask for tomorrow. It's more of a developing framework for using eye data more intelligently. But it points toward where glaucoma care may be heading: earlier detection, better risk prediction, and more personalized monitoring. For patients, this reinforces why consistent testing matters. Your OCT scans, visual fields, and optic nerve photos are not just routine appointments. Over time, they create a data trail that helps your doctor see whether your glaucoma is stable or changing. Next, let's talk about blood pressure. A recent study from Bascom Palmer Eye Institute looked at whether 24-hour blood pressure monitoring could help identify glaucoma patients at higher risk of progression. The study followed patients with primary open-angle glaucoma and measured their blood pressure over a full 24-hour period using ambulatory monitoring. The key finding was that lower minimum blood pressure over 24 hours was associated with faster thinning of the retinal nerve fiber layer, or RNFL. That matters because RNFL thinning is one of the structural signs doctors watch in glaucoma. Interestingly, regular in-office blood pressure readings were not predictive in the same way. That makes sense. A blood pressure reading at a doctor's office is just one moment in time. It may miss what happens overnight, during sleep, or during dips throughout the day. Now, this study does not prove that low blood pressure causes glaucoma progression. The researchers were careful about that. But it does support something glaucoma specialists have discussed for years. Optic nerve health may be affected not only by eye pressure, but also by blood flow and vascular factors. The patient takeaway is not to stop blood pressure medication. Do not adjust your medication on your own. But if your glaucoma is progressing despite low or controlled eye pressure, it may be worth asking your eye doctor whether systemic factors like blood pressure should be discussed. This is especially relevant for people who have normal tension glaucoma or progression that seems out of proportion to their measured eye pressure. Our third story is about visual field testing. Zeiss Medical Technology and Envision Health Technologies announced a strategic collaboration focused on virtual reality-based functional testing for glaucoma. Zeiss is already a major name in visual field testing, especially with the Humphrey Field Analyzer, which many glaucoma patients know well. Envision is working on VR-based, software-driven visual function testing. Their approach includes headset-based perimetry and AI analytics. Why does this matter? Because visual field testing is essential in glaucoma, but it is not exactly anyone's favorite appointment. It can be tiring, stressful, uncomfortable, and sometimes unreliable. Patients may lose focus, and the equipment is usually fixed in a clinical setting. A portable VR-based system could potentially make visual field testing more comfortable, more accessible, and maybe more engaging. The word potentially is important. This does not mean the standard visual field machine is disappearing next week. Traditional perimetry is still the clinical backbone for glaucoma monitoring, but this partnership is worth watching. The patient takeaway: visual field testing may become more patient-friendly over time. For now, keep doing your regular visual fields. Next, let's talk about sleep apnea. A large retrospective study using a 12.5 million patient dataset looked at the relationship between obstructive sleep apnea and glaucoma risk. The study found that patients with obstructive sleep apnea had a higher risk of developing glaucoma compared with sleep-tested controls. Another group with a positive airway pressure device record had a higher hazard ratio, but that does not mean CPAP therapy causes glaucoma. The possible connection makes biological sense. Sleep apnea can cause repeated drops in oxygen levels during sleep, affecting blood flow to the optic nerve. The patient takeaway: if you have glaucoma and symptoms of sleep apnea like loud snoring or daytime sleepiness, discuss it with your doctor. And if you already use CPAP, do not stop using it. Untreated sleep apnea has serious health risks. This is a conversation for your eye and sleep doctors. Finally, a treatment update: Thea Pharma has launched ZOLYMBUS in the United States. ZOLYMBUS is bimatoprost ophthalmic gel, 0.01%. It is used to reduce intraocular pressure in patients with open-angle glaucoma. The big feature here is that it is preservative-free. Preservatives like BAK can contribute to ocular surface irritation for some patients. ZOLYMBUS uses a mucoadhesive gel formulation designed to increase contact time on the eye surface. It is dosed once daily in the evening. The patient takeaway: this is not a brand new glaucoma drug class, but it is a new formulation of a familiar pressure-lowering medication. If you have trouble with irritation or preservative sensitivity, this may be something to ask your doctor about. So, what connects all 5 stories this week? Glaucoma care is moving in 2 directions at the same time. One direction is better technology, AI, oculomics, VR testing, and smarter ways to monitor the disease. The other direction is more personalized care, looking at blood pressure, sleep apnea, and the whole patient. Glaucoma is complex. The future of care may involve a fuller picture: structure, function, blood flow, systemic health, and genetics. That's it for this week's Pressure Check. If you found this helpful, subscribe for weekly glaucoma news. I'm Daniel. This is Pressure Check, and I'll see you in the next update.